here's Chip Franklin.
I know a lot of you guys are maybe listening to me on the road as you head out of town, and I don't care where you're listening. I appreciate you listening every day, and as do everybody here. Nikki Maduro, right on up to John Rothman, who'll be with me. We're going to actually have a little conversation near the end of the show and talk about getting this guy out of office even when he loses the election, but that's a whole other thing. Follow me on Twitter at Chip Franklin. You can text me, and I got a lot of great texts today. And I don't mind if you disagree with me. Let's be on point and let's talk about it. And I'd love you to text in. And you can email me too at chip@kgoradio.com. Now, so I had a physical and back in December, and everything was perfect except my one of the blood level things was still below normal, but it had gone up from last time. He said, so go back and, come back in 4 months and get, and give me some blood and we'll check it again. Well, that was April and almost May. And so I haven't gone back. And I thought maybe I really should go back, but I don't want to go back into, a doctor's office with all this craziness going around, even though some of my friends are. Should you delay a doctor's visit during a pandemic? Well, that's a good question. Dr. Akami Haas is from UCLA, where he is on the board of counselors at the UCLA School of Dentistry and co-founder of the Super Dentist. He's going to take his cape off for a minute, though, and talk to us here. Dr. Haas, good to have you with us. Thank you.
Thank you so much, Chip.
All right. Obviously, there is a trade-off almost in everything with this pandemic. But if I'm to believe what I'm reading and from you, don't trade off seeing a doctor, especially if you're supposed to regularly. Is that accurate?
Yes. So, of course, we know that this virus affects the older population and those with health issues differently, right? They're at a higher risk of complications from COVID. So we can't get any younger, of course, but we can get healthier. And one of the most important ways to get healthy and all of those is to pay attention to your overall health, pay attention to your oral health. And, of course, going to the dentist, I have a dental office, and we have a group dental practice with all sorts of specialists. And I think our patients really understand the value of oral health and how it impacts everything in their life, including their overall health, which is so critical during this pandemic. So I would encourage everybody to go back. Of course, we also need to know that we've learned a lot about this virus over the last 3 months. It was different like 3 months ago when we first had the surge in the COVID cases and we had to close down for several weeks because we didn't have enough PPEs. We wanted to make sure our physician colleagues have adequate access to it. And we didn't know enough about this virus to make sure that we can protect our staff and our patients. But now we do. We have adequate PPEs for most part. And of course, we know a lot more about the virus. We've had now enough new technology and protocols in place to make sure everybody's safe.
And obviously, when people come into dentist's office, they're checking their temperature. And I had Dr. Dina Grayson on yesterday. She's not only an MD and PhD and a biochemist and a pandemic expert, but somebody called in with the very question. And so it's really a good coincidence we have you on today. And that question was about going to the dentist. And she said, look, the truth is the dentist is a greater risk than you are, because you don't have a mask on. And the dentist not only has a mask on, but sometimes they have that whole beekeeper outfit you guys wear, right? With the shield that comes down, right? And so even though you're in the person's face, it's pretty well masked. It'd be pretty hard for the droplets to get through the mask and through that shield, especially it can't get through the plastic shield at all. Unless,
for sure. And also, Chip, I think what I want to really emphasize and have your listeners think about it is that's the PPEs that we wear. And you're right, we work in the mouth, and obviously we're at a high risk. In theory, we're at a high risk profession because saliva is there, we have droplets. But in practicality, with all the protocols and processes we have into place, we thoroughly screen people, and we only allow healthy patients to be inside the office. And so by the time we actually see a patient, the chances of a person sitting in our chair having COVID is very, very low. So we look at our PPEs not at the first, at the very last place that we should be protecting ourselves. The protection starts with really thorough screening on the phone. Then, like you said, we do screenings at the doors. We do temperature checks. We virtualize our lobby so patients really stay out in their cars and outside. So we escort them to the chair, and we've modified, even our procedures so we don't produce aerosols as much as we used to. So we've done so many modifications to everything we do to make sure everything's safe. So you're right, we do have PPEs, but we're really not really worried about it as much as the average person that doesn't work in a dental office may think that we're at risk. So we're making sure that, because like you said, we work with patients all day long. We want to make sure that we protect not only our patients, but our staff and our doctors as well. And we feel very good about that right now.
Yeah, and I would think that, I actually have made a dentist appointment. I haven't had a cavity in almost 30 years.
Wow.
Because, yeah. But I mean,
Good.
I don't eat sweets, and my wife,
for you, Chip.
my wife makes me brush twice a day and floss. I even floss. I started flossing about 10 years ago, and I even do that once a day. But I mean, I've been lucky. It's all genetics, I know, on that line, about as far as cavities go. That said,
I wouldn't say it's all genetics, but you're doing all the right things. You're eating healthy, you're brushing and flossing, so that a lot of kudos to you.
Well, and it's like one of those things too, is that you get to a certain point. I like the dentist better than the doctor's office, because nobody ever goes into a dentist and comes out with, like you got 10 months to live, right? So, the worst case is you need a root canal or something, right? Which is a pain in the ass. I've had one, but it's not the end of the world. All right, so this is good to hear. So but I think you're right, and I think that it's important during this period not to make yourself more vulnerable by not, making sure you stay healthy, and that includes a routine visit to a physician when you have it, and it's interesting too, because with telemedicine, I think that's what it's called. People can talk to their doctor. They can have and they can describe it, and you can even go to the camera, right?
Exactly.
And, so some of that stuff works.
So you're right. I mean, during the closures, as you know, dental offices across the country will close between 6 to 8, 10 weeks, between, depending on the state. We really try. I mean, our physician colleagues, a lot of those procedures could go online and with telehealth, like you said, and telemedicine. But with dentistry, it's very difficult, because most of the things we do really requires the patient and the doctor to be there together, right? We have to clean the teeth, we have to pull the tooth, we have to fill the teeth. So we can do some minor things like screenings, emergency screenings, or some I'm an orthodontist, so we can do some orthodontic procedures or some consultations, evaluations. But most dental procedures are done in person. But while we were closed, I think all of us as a profession really looked at this virus, and we wanted to, because we've had to deal with other pathogens, as you know, HIV, hepatitis, all sorts of things for decades. And we have really good infection controlling processes. And now we've really added some really additional things, protocols and processes in place. And so now we feel really good about it, and we can see our patients, and they're going to be safe, and we're going to be safe, and everybody's going to have a healthy mouth.
Dr. Haas, great. Let's get you back again. I really appreciate your time. Thank you so much, and have a safe and happy weekend, okay?
Thank you. You too. Thank you very much.
Again.
Bye-bye.